Hi, this is an introductory video about quality improvements in healthcare. I'm Dr. Hamer, a clinical psychologist working with the Veterans Affairs Quality Scholars Program. This is a national interdisciplinary training program for doctorally prepared scholars and leaders in the science of healthcare improvement. One of the most important ideas for anyone to understand if you're working in the healthcare system is the concept of quality improvement. Quality is necessary, and quality improvement actually drives industry standards. So, not recognizing the need for quality improvements in any industries, analogous to sitting in a sinking boat and using a 1-gallon pail to remove water, rather than finding the damaged parts to repair areas that may be contributing to the leak. As identified by the National Academies of Medicine, there are 6 dimensions of healthcare quality. Here we'll be focusing on effectiveness. Specifically, how we can target this dimension of quality to improve the standards of care and the health outcomes of the populations we serve. The National Academies of Medicine defines effectiveness as providing services based on scientific knowledge to all who could benefit and refraining from providing services to those not likely to benefit. Every health profession has its own way of advocating effective services and interventions. And although the language used to convey this is different across fields, the core message of the languages is the same and aligned with the mission of reducing the burden of illness, injury, and disability, and improving the health and functioning of the people served. Effective care is based on the use of systematically acquired evidence to determine whether an intervention produces better outcomes than alternatives, including the alternative of doing nothing at all. We gain this evidence from laboratory studies, epistemological research, clinical trials, epidemiological data, and outcomes research. We know that quality gaps preclude the ability of healthcare systems to effectively meet patient needs. The National Academies of Medicine identified 3 main quality problems, and these issues are related to overuse, underuse, and misuse of available services and interventions. In essence, effectiveness means avoiding overuse, underuse, and misuse of services, respectively. In the research pipeline, efficacy studies examining the effects of interventions in ideal environments are conducted before effectiveness studies. Additionally, implementation research regarding the integration of evidence-based interventions into clinical practice is conducted after effectiveness studies. Effectiveness studies, then, are those studies that examine whether interventions actually work in clinical practice in a real-world setting. The research agenda in quality improvement may benefit from moving beyond attempts to show whether interventions work and towards understanding the determinants of effectiveness. The potential generalizability of findings on the effectiveness of quality improvement strategies may be much more limited than the generalizability of clinical trials, and so the question of whether a quality improvement strategy works is only of initial interest. The broader questions of why, when, where, and for whom these interventions work most effectively is of much greater practical concern. Having a thorough understanding of the underlying mechanisms that make an intervention work will allow for successful application of the intervention in other settings and help improve its effectiveness. When we consider effectiveness, it may be useful to observe the construct from the perspective of other industries. For instance, the food service industry uses mechanical props and cosmetic accessories in advertising, and this is analogous to efficacy studies conducted by assuring rigorous control of all variables other than the intervention itself. On the other hand, food items made in the real world don't always look as appetizing as those presented in ads, and this is analogous to effectiveness studies, in which generalizability is sought. Results of quality improvement efforts regarding effectiveness are highly variable and inconsistent, sometimes to disappointing depths, and there are a few reasons for this. Related to the provision of evidence-based practices, various quality management programs may have the same titles and basic improvement terminologies. However, they may be very different regarding their specific improvement structures, trainings, measurement methods, and levels of resource investment. This ultimately results in observing variable impacts of the effectiveness of such programs upon evaluation. Quality improvement often occurs in very different forms across organizations, and the effectiveness of quality improvement strategies depends upon the context in which these efforts are used and implemented. Context for quality improvement has been defined to include those factors that potentially mediate the effects of interventions, such as leadership, personal skills, organizational resources, and data availability. The bottom line here is that some organizations may seek quality improvement because their long term futures depend on it, while other organizations embark on quality improvement initiatives because there's a culture for improvement, with strong support from leadership and quality improvement aligns with pre existing organizational values. Some of the most frequently reported contextual factors related to the effectiveness of quality improvement interventions include the presence or the lack thereof of quality improvement teams, quality improvement support and capacity, organizational factors, microsystem quality improvement initiatives, and external environmental factors. Ultimately, knowing which services are likely to be effective requires that healthcare systems continuously monitor the results of the care that they provide and use that information to improve care for all patients. Regarding overutilization, there's clear evidence of reliance upon unnecessary and expensive radiologic imaging when patients report experiencing lower back pain. As much as 50% of lumbar spine MRI scans have been observed to be either inappropriately ordered or of uncertain clinical value. Despite strong evidence for benefit, upon discharge from hospitals, only 56% of eligible coronary artery disease patients were referred to cardiac rehabilitation. Antibiotics have greatly increased life expectancies of populations by paving the way for medical advances. However, some ineffective practices like prescribing antibiotics for viral infections, including some ear infections, have resulted in ineffective pharmaceutics for some strains of bacteria. In summary, when considering services and interventions for your patient populations, you should be certain to always consult your professional literature and determine the most recent evidence based practices and appropriate methods for sustainable implementation efforts. Additionally, you should consider the cultural context of your work environment as well as that of the patients that you serve. Finally, you should always use data to guide your clinical decision making processes.